I'm Mary Roger from Quality Insights of Delaware, and I'd like to welcome you to our second program, our repeat session of the statewide ADRC training. I'd like to introduce Mr. William Love. Bill Love is the director of the Division of Aging and Services for Adults with Physical Disabilities.
Thank you, Mary, and good morning, everyone, and welcome to today's workshop. We really do appreciate you taking the time from your schedules to learn more about the Aging and Disability Resource Center and how it can help you and your colleagues access services for people who need them, as well as help all of you who are working in long-term care facilities meet your requirements for people you have identified who want to move back to the community, help you be able to do that. But first, I want to introduce the Division of Services for Aging and Adults with Physical Disabilities and what we're about. We're one of 12 divisions within the State Department of Health and Social Services. Our role in the department is to collaborate with sister agencies and community organizations, as well as the federal government, to build access to long-term care services. Our mission is to maintain and improve the quality of life for older Delawareans and adults with physical disabilities. Our resources include caseworkers and nurses who work with families in the community, administrative staff who manage our finances and the many contracts that we have, as well as staff who intervene to protect health and safety, including Adult Protective Services, which is now part of the department. Our agency also includes 3 long-term care facilities, which have about 350 residents living there, and we are working now to reduce the census of those facilities over time. Much of our community-based services are provided by community organizations with whom we contract, with oversight provided by our staff. A significant portion of our funding is provided by the federal sources, including the Administration on Aging and Medicaid. Our agency provides and finances a variety of long-term care services, including such things as adult day services, support for caregivers, assistive technology, attendance services that help people go to work, as well as help them to provide their personal care needs every day, caregiver resources including respite services, various meals programs including home meal meals for those who cannot leave their home, and home modifications that help make homes more accessible. Just a variety of services, those are only a few examples that are designed to help people continue to live in their own home as long as they are able to do that. We also provide an extensive network of information and referral services through the Aging and Disability Resources, which is the focus of today's workshop, which is designed to help people get information about services, help lengthen the services, as well as help long-term care facilities access services for individuals who want to transition from the home, and will help you also meet the requirements set forth by the federal government for that. I want to mention 2 critical issues to start that are impacting all of our work, the work of all of us in this room. The first is the changing population demographics in Delaware as well as across the country. Delaware's older population is increasing at a faster rate than in most other states, in part because of high rates of in-migration. Delaware, in fact, has the 5th highest net migration rate in the country for persons aged 55 to 74. Whereas the nation as a whole, the older population grew by about 10% over the past 10 years, Delaware's population has grown by close to 25% in that same period. The trend towards an aging population in Delaware will continue. By the year 2020, which is only 10 years away, older persons will make up almost 25% of our total population. These numbers are even more staggering for certain subpopulations in certain areas of the state. For example, Sussex County is one of the top 10 highest growth rates in counties across the country for the older population in America. We are just now beginning to feel the impact of this growth that will continue to grow in the future. The second issue I want to talk about is Delaware's long-term care expenditure patterns, which are symptomatic of our over-reliance on facility-based services. As you can see, 87% of our long-term care dollars for aging and disability services are spent for facility-based services. The overall goal is to reduce our reliance on facilities, not by restricting access to those services for those who need and want them, but by improving access to community-based services. This is not about closing nursing homes, which play a critical role in our continuum of care. This is about providing the right care at the right time to the right person. Our over-reliance on facility-based services is not good public policy for several reasons. First reason is choice. The overwhelming majority of Delawareans, and that's true across the country as attested by several surveys done, over 80% want to have services that support them in their own home as they grow older. The second reason is cost. For every person we serve in a long-term care facility, 3 people can be served in a community, and the comparison has been higher than that in some other surveys. And last and certainly not least is the Americans with Disabilities Act, which mandates that public agencies such as our own provide services in the most integrated setting appropriate to individual needs, which has been affirmed by the U.S. Supreme Court in the Olmstead decision. So what do people want? A number of surveys have been conducted across the country in recent years, including Delaware, which confirms people's desire to age in place. This means that we need to grow the capacity of our community-based services to meet the growing market demand for in-home services, services that have the flexibility to meet individual needs where they are now. Caregiver supports and other kinds of supports such as that will be critical moving forward in order to enable us to do this. In addition to wanting to grow old in their own home, Delawareans want their independence. People, as they grow old, have a great fear of losing their independence, and that fear sometimes seems stronger than their fear of death. People also want more options, more choices, and more control. They want more control over what services are provided, where the services are provided, when they're provided, and who provides them. Those are some of the things that we need to implement going forward also. We'll talk a little bit about the Americans with Disabilities Act, which provides a legal basis for a lot of the mandates that the federal government is setting. Last year we celebrated the 20th anniversary of the passage of the Americans with Disabilities Act, which prohibits discrimination on the basis of one's disability. This has had a significant and very positive impact on the lives of persons with disabilities and has been a major milestone in efforts to fully integrate persons with disabilities into everything our society has to offer. The ADA provides similar protections against discrimination for Americans with disabilities that the Civil Rights Act of 1964, which made discrimination based on race, religion, and sex illegal. The ADA covers a variety of things, including employment, public transportation, public accommodations such as hotels and restaurants, and telecommunications. The federal government has a central role in enforcing the law and has gotten more active in recent years. About 54 million Americans, or 20% of our population, have a disability that meets the standard for coverage under the ADA. The Olmstead decision, which is related to the ADA, established that state Medicaid programs must operate in ways that in fact do comply with the Americans with Disabilities Act. And the Olmstead decision was about over 10 years ago. 2 women who were institutionalized in a psychiatric facility in Georgia had been there for several years. In fact, wanted to transition back to the community. The folks in charge of the facility they were living in did not enable that to happen. They filed suit. The suit made its way to the Supreme Court, and the Supreme Court ruled, in fact, that under the Constitution, the Americans with Disabilities Act, that the state of Georgia was, in fact, required to provide those services to help them live in the community because they wanted to move back to the community. So it's based on choice, and also because professionals testified that, in fact, their needs could be met in the community. The impact of the Olmstead decision has been growing over the past 10 years. It's continuing to grow. It's impacting us in Delaware. Those of you that have read the paper about the recent Department of Justice settlement impacting Delaware Psychiatric Center is based on the Olmstead's decision's interpretation of the Americans with Disabilities Act. In fact, Delaware Psychiatric Center, as a result of that, needs to significantly reduce its population and develop a more vibrant system of mental health services in the community. The Olmstead decision impacts all of us because it impacts people that we serve. We have to make sure that we meet that standard of tests as set by the ADA, that if they do want to live in the community, and we've already learned that most people do want to live in the community, that if in fact their needs can be met in the community, and we also know that most needs in fact can be met in the community, that we need to make sure we set up programs to enable us to do that. So I'll talk a little bit about building access to community-based services, which is what we're doing in order to prepare for the growing aging population, as well as to make sure we're in compliance with the Americans with Disabilities Act and providing services in the most integrated setting possible. There are a number of keys to building access to community-based long-term care services. One is easy access to information about services. People often do not know about long-term care services or understand how to access them. Oftentimes, their first encounter with the need for long-term care services in a crisis that may be impacting their families. Not only do they need information, but also people need help to actually help them access those services and link them to the services that they need. There are people who are living in facilities who want to move back to the community, also need help in doing that and helping them get the services that they need to make sure they're safe in the community also. We have several initiatives that are underway, just to give you a few examples. First is the Money Follows the Person in nursing home transition programs. You're going to learn more about these in today's workshop. But these programs are geared towards helping identify people living in facilities who in fact can transition back to the community and putting in place services to help them do that. The second service being implemented is the Aging and Disability Resource Center, which you'll also learn much more about today. But that's geared to provide 24/7 access to information about long-term care services, as well as to provide one-on-one support for families to help them access those services. We also are working on pre-screening, various kinds of pre-screening initiatives, diversion activities where people that are referred for admission to a long-term care facility, we can meet with them to identify what their needs are and make sure they're aware of community-based services that may also be available to help them to make sure that they truly need the level of care that's provided in a long-term care facility. Housing is a big issue for services. I know it's an issue all of you are aware of, especially accessible housing, most especially affordable housing, as most people or many people cannot afford the housing that is available. There are a number of programs that are being set up to help provide more access to housing. The governor has made available $1.5 million this year in additional housing supplements that will help people afford housing, and we're just beginning to use that program. We're also setting up housing casework services, because oftentimes folks that work in our field do not know how to access housing or not familiar with the housing developers, and we have the housing caseworkers will help staff do that. We're building our partnerships with hospitals, and a number of you are from hospitals that are here might be aware of that. That's to help hospitals with discharge planning. Oftentimes hospitals have critical cases at the point of discharge with a limited number of resources that are available post-discharge to help that family and that patient who is now leaving the hospital. So we are partnering with the hospitals to help provide them more access to long-term care services also, so that people, once they leave the hospital, can have the long-term care supports they need going forward. And last but not least, as an example, I want to mention the Diamond State Health Plan. I want to give you a brief summary of this. This is very important for all of us, especially for long-term care facilities. It's going to change the way that Medicaid finances long-term care facilities, will directly impact facilities in the future. I want to emphasize that those of you that are interested in more detailed information on this, we have webinars set up. We can go out and make detailed presentations to you and your organizations and other stakeholders. We can also provide additional written information about it. Diamond State Health Plan Plus is an integrates nursing facility services and home and community-based services for the elderly and adults with disabilities who are Medicaid eligible into an already existing managed care system for healthcare services. The existing managed care system for healthcare services is called Diamond State Health Plan. You might be aware of that. That's been in operation since the mid-90s, 1996. And the benefit package provided it includes hospital care, acute care, outpatient visits, behavioral health services, and other healthcare related services. This program has been so successful that Delaware has been able to serve over 30,000 more residents with Medicaid-funded health care services as a result of its implementation. What will happen is those that are currently eligible for Medicaid and eligible as well for long-term care services will transition to Diamond State Health Plan Plus effective April 2012, so it's about a half-year away. They will have access to the benefit package now provided in the healthcare area by Diamond State Health Plan, hospital care, physician services, other services. They also have access to a benefit package of long-term care services, which will include things such as case management, nursing home care, assisted living, other in-home supports and respite care, various kinds of long-term care services that they may need. Populations that will be eligible and will be included in Diamond State Health Plan Plus include all current Medicaid enrolled residents of nursing homes that are eligible for Medicaid, all current enrollees of the elderly and disabled waiver, which provides Medicaid funding for community-based services, and there are about 1,400 current participants in the Medicaid waiver, as well as those that are enrolled in the AIDS waiver, as well as others, for a total population of about 10,000 individuals who will be provided this coverage. Diamond State Health Plan Plus will provide more options for people, more access to community-based services, as well as, we hope, improve care coordination across services delivery. That program, again, is scheduled to implement in April 2012. It's on schedule, and if your facility or your program would like more information about that, please get in touch with us and we can come to provide that. I'm now going to turn the mic over to Chris Oakes, who's going to talk a little bit more about the Aging and Disability Resource Center.